Today we will discuss about the orbit. Orbital cavity, it is a pyramidal in shape. Anteriorly it is a broad and the posterior it is narrow and situated on the each side of the root of the nose. It provides the socket for the rotatory moment of the eyeball and the long axis of the orbit which passes backwards and medially. So both the eye, the long axis which goes backwards and medially, so the axis which is nearly meet at the 90 degree at the posteriorly. So it is the axis of the orbit. The orbit, it contains the eyeballs, it contains the orbital and bulbar fascia, it is extraocular muscles, vessels, ophthalmic vessels, supraorbital and infraophthalmic veins, nerves, optic, oculomotor, trochlear, abducent and branches of the ophthalmic nerve, sympathetic plexus, lacrimal gland and orbital tract. First of all, we will discuss about I will show you the part of the orbital fascia. Most of the orbital fascia we have removed, but this orbital fascia, it is also called the periorbita, and it forms the periosteum of the bones. Here you can see this is a periosteum of the bones. So it is a medial surface of the orbital surface, which is all four surface which is covered, but here I will show you the medial surface of the orbit, and it is due to the loose connection with the bone, it is easily stripped, and posteriorly it is continuous with the dura mater with the sheath of the optic nerve, and the anteriorly it is continuous with the periosteum lining to the bone around to the orbital margin, and then becomes continuous as a periosteum of the adjoining bones. So this is the orbital fascia, and there is a gap on the infraorbital fissure. I will show you. Here you can see this is the infraorbital fissures and gap which is filled up by the one muscle. It is called the orbitalis muscles. This is the orbitalis muscles, and the upper and lower margin of the orbit, it send off a flap-like continuation. It is called the eyelid. This is the upper eyelid and this one is the lower eyelid. So, and some places it makes the pulley mainly for the trochlear pulley for the infraoblique muscles. So here you can see this is the infraoblique and it makes the trochlear pulley. So this is about to the regarding the periosteal fascia, or it is called the orbital fascia or periorbita. Now we will discuss about the orbital fascia. It is the inner side which is covering to the eyeballs, and it forms the thin loose membranous sheath around to the eyeballs. It extends from the optic nerve to the sclerocorneal junction. So it is anteriorly it extends up to the sclerocorneal junction. Here it is difficult to show you, and it is separated from the sclera by the episcleral space, and which is traversed by the delicate fibrous band. So the eyeball can freely move with this sheath. The sheath is pierced by the tendon of various extraocular muscles. There are 7 extraocular muscles which is pierced by the this bulbar fascia, and there is along with it there is a ciliary vessels and nerve around to the at the entrance of the optic nerve. Medially the sheath gives off number of expansion, and it makes medially it makes the medial check ligament. This is the right eye and this is the root of the nose. So it is medially there is a strong triangular expansion of this bulbar fascia, and it is attached to the medial rectus and lacrimal bone. Medial rectus and lacrimal bone. So here this is a medial rectus, and here there is a lacrimal bone, and internally it is attached. It makes the medial check ligaments. Same way it on the laterally over the from the lateral rectus, this is the lateral rectus, to the zygomatic bone. Here we have cut the zygomatic bone, so it is from the orbit to the zygomatic bone. Here there is it makes the lateral check ligaments, and each and individual muscles which is also tubular sheath which is covering to the muscle, it is a continuation of the bulbar fascia. Other thing, it makes the suspensory ligament of the eye here from the medial check ligaments, and from here the lateral check ligament on the inferior surface, and this it makes the suspensory ligament of the lockwood, and it contains the two muscles, inferior rectus, and this is a inferior oblique muscles. So these are the two muscles which is lies inside the suspensory ligament, which extend from medial check ligament to the lateral check ligaments, and it is slung like hammock below the eyeball and formed by the union margin of the sheath of the inferior rectus and inferior oblique muscles with the medial and lateral check ligaments. So this is about to the bulbar fascia. Now we will discuss about the which are the muscles inside the eyeballs. First of all, I will show you the most upper after removing the bulbar fascia. You can see the first nerve, it is a frontal nerve. The medial one, it is a supratrochlear, and the lateral one, it is called the frontal nerve. It divides into the supratrochlear and supraorbital nerves. Another nerve which is lies on the ophthalmic. Here you can see this is the, I will show you the reflect the temporalis muscles, and here you can see there is a trigeminal ganglion. This is a trigeminal ganglion. This is the ophthalmic division. This is a maxillary division, and this is a mandibular divisions. From the ophthalmic division, here you can see this is the first nerve we already discussed. It is a frontal nerve. It is the largest branch of the ophthalmic division, and it is just after removing the roof of the orbital plate. You can see the frontal nerve just below to the bulbar fascia, and it divides into the two branches, supratrochlear and supraorbital. Supratrochlear, which supplies to the skin of the lower part of the forehead and upper eyelids, and the supraorbital laterally it supplies the skin of the forehead, scalp and frontal sinus. It is a supraorbital. Another nerve, the branch of the ophthalmic division of the, it is the nasociliary nerve. I will show you the nasociliary. First of all, I will reflect. I will cut the levator palpebral superioris from the above. Here you can see these are the two muscles which is reflected on the downside. This is both the muscles, levator palpebral superioris and superior rectus we have reflected, and here you can see there is one nerve which is crosses above to the optic nerve. This is the optic nerve, and just above to the optic nerve, the branch of the ophthalmic nerve, it is called the nasociliary nerve, which crosses between the crosses the optic nerve from lateral to medial sides, and it becomes medially. Here you can see it becomes continuous as a, along with the ophthalmic artery, it becomes continuous as a anterior anti-ethmoidal nerve. So it becomes continuous as a anti-ethmoidal nerve, and here you can see this anti-ethmoidal nerve which is passes inside the anti-ethmoidal foramen along with the anti-ethmoidal vessels. So this is the this is the vessels, and this is a white color. This is a nerve. So it is the second nerve. It is the nasociliary nerve. Passes through the superior orbital fissures. Here I will show you. This is a superior orbital fissures. Superior orbital fissures, and with the common within the common tendinous ring in the orbit passes from lateral to medial side with the ophthalmic artery. It enter into the this nasociliary nerve gives the 5 branches. I will show you the branches of the nasociliary nerve. Here first of all I will show you this is a nasociliary nerve which is gives the 5 branches. First of all, it gives a communicating branch to the ciliary ganglion. Here it gives the this is the lateral rectus, and it gives the ear branches. Just it gives the first branch. It is a communicating branch with the ciliary ganglion. This is a ciliary ganglion which lies between the optic nerve and lateral rectus. So this bulge, it is a ciliary ganglion. So first it gives the communicating branch to the ciliary ganglion. After that, this communicating branch passes forward without interruption inside the ciliary ganglion. It gives convey the sympathetic fiber to the fibers from the internal carotid plexus and sensory fiber for the eyeballs. Other branches, it is a long ciliary and short ciliary. Here you can see this is a nasociliary nerve, and this nasociliary nerve, it gives a long as well as short ciliary. It is difficult to show you here, but it gives a long and short ciliary branches. These long and short ciliary branches which supplies to the these long and short ciliary branches, here you can see these are the branches which is supplies to the runs forward inside the choroid and sclera and supplies to the ciliary body, and it supplies to the ciliary body, iris and cornea. This fiber convey the pain, touch and thermal sensation from the eyeballs. Also postganglionic sympathetic fiber from the superior cervical ganglion and supplies to the dilator pupillae. So this is the long ciliary as well as short ciliary. Just below to the superior rectus, this nerve which gives the one branch, here you can see it gives a branch. It is called the infratrochlear nerve. This one is the infratrochlear nerve, and this infratrochlear nerve emerge below to the superior oblique and supplies the skin of both the eyelid and adjoining part of the side of the nose and conjunctiva and lacrimal sac and lacrimal canaliculi. The other branches, here there is a posterethmoidal nerve. Here you can see this is a posterethmoidal nerve. This is the it is a branch. This posterethmoidal nerve which supplies to the passes through the posterethmoidal foramen and supplies to the ethmoidal and sphenoidal sinus. And here you can see it is a continuation of the nasociliary. It is a anti-ethmoidal nerves, and it also supplies to the ethmoidal sinus as well as lacrimal part of the lacrimal apparatus. So this is the nasociliary nerve, and now we will discuss about the third nerve just above to the lateral rectus. This is the lateral rectus, and above to this lateral rectus there is a nerve and vessels. It is a lacrimal nerve and vessels. So the lacrimal nerve, it is a third branch, and here you can see it is a lacrimal gland. It innervates to the lacrimal glands. So it is a third nerve. It is a lacrimal nerve. So this is the lacrimal vessels and nerves. So it is a third branch, and it supplies to the lacrimal gland and conjunctiva and upper eyelid. So you have to remember there are 3 branches of the ophthalmic division. One is the largest branch. It is a frontal, and it divides into the supraorbital and supratrochlear. Another is the lacrimal nerve which supplies to the lacrimal gland as well as it supplies to the conjunctiva and upper eyelid. Always the lacrimal nerve and vessels lies above to the lateral rectus, while the frontal nerve, it is the most superficial inside the roof of the orbit, just above to the both the muscles, superior rectus and levator palpebral superioris. Above to it there is a frontal nerve, and the third nerve we already discussed. It is a nasociliary, which is the just below to the superior rectus, and between the optic nerve, just above to the optic nerve, and below to the superior rectus, which crosses the optic nerve from lateral to medial side, along with the ophthalmic artery, and it is the third branch of the ophthalmic artery. So these are the three branches of the ophthalmic artery. You have to remember, nasociliary always crosses from lateral to medial side, and it gives the 5 branches. Just near the emerging, it gives the communicating branches to the ciliary ganglion. Here you can see it is a branches which is given to the ciliary ganglion. Then it gives a long and short ciliary nerves, long as well as short ciliary nerves. Here I have shown you, this is a nerves which is emerging after crossing the optic nerve, it gives a long ciliary and short ciliary nerves, and then it gives the infratrochlear nerve. This is an infratrochlear nerve, anti-ethmoidal nerve, and here it gives the posterior-ethmoidal nerves. So this is the branches of the nasociliary nerve. Now I will show you the muscles. Here you can see this is a superior oblique, and it is innervated by the muscles. It is innervated by the trochlear nerve. So trochlear nerve, it is very small. Below to it, here this is the oculomotor nerve. Oculomotor nerve, the characteristic of the oculomotor nerve, which supplies to the, it divide into the 2 division, upper division and lower division. Here you can see, I will show you the lower division. This is the lower division of the upper division of the oculomotor nerve, which supplies to the, this nerve which supplies to the superior rectus and levator palpebrae superioris, and here you can see this is the lower division which is passes in between the upper and lower division. There is a nasociliary nerve. This is a nasociliary nerve, and this lower division, here you can see, I will show you from the inferior aspect. This lower division, along with its, here you can see with the inferior rectus, you can see it supplies to the inferior rectus as well as it supplies to the inferior oblique muscles. So lower division and upper division, in between always you have to remember it passes the nasociliary nerve. So this is a nasociliary nerve, and this is a lower division, and this is the upper division. Upper division supplies to the superior rectus and levator palpebrae superioris, and the lower division which is goes along with the inferior rectus muscles, and it supplies to the inferior rectus and levator palpebrae superioris. This is the from the lateral side. I have reflected the eyeball from the upper side, and this is the inferior division of the oculomotor nerve, and this inferior division long branch which is goes to the inferior oblique muscles, but here it gives the branches to the inferior rectus, as well as it gives the branches which goes medially, and it supplies to the medial rectus muscles. This is the branches which supplies to the medial rectus. Same branch I will keep from the medial side. Here you can see this is the medial rectus, and the same nerve which is the emerging, which is supplies to the medial rectus from the its inner sides. Here you can see this is a nerve to medial rectus. So inferior division supplies to the medial rectus, it supplies to the inferior rectus. This is the branch to the inferior rectus. Here you can see this is a branch to the inferior rectus, and this long branch, it is called the branches to the inferior oblique muscles. And the superior root we already discussed, it supplies to the superior rectus, and there is a levator palpebrae superioris. So this is the nerve which is the superior root. This is the superior root or upper root of the oculomotor nerve, and in between the upper and lower root there is a nasociliary nerve which is pass. So it is a third nerve, nasociliary, and this is the upper root of the oculomotor, and below it is the lower root of the oculomotor nerve, and this is the trunk of the oculomotor nerve. The now we will discuss about the ophthalmic artery. Here you can see this is just below to the trigeminal, deep to the trigeminal ganglion. You can see this is the internal carotid artery, as said, and it gives the ophthalmic artery. And basically it divides into the two main group, lateral and medial. The lateral group, here you can see this is the artery which goes to the lacrimal gland. It is a lacrimal branch, and it gives there are many small branches, but it is difficult to here to dissect. It is gives the zygomatrico-facial, zygomatrico-temporal. It gives the lateral palpebral branches. Initially it gives a recurrent meningeal and muscular branches, which is given by the lacrimal branch, as well as from the main trunk. It is along with the just below to the levator palpebral superioris and superior rectus. We can reflect. Here you can see there is a main trunk which passes along with the nasociliary nerve. So here you can see this is the main trunk of the ophthalmic artery, and this is a nasociliary nerve. So this main trunk of the ophthalmic artery, it gives many branches. Here you can see this is the nasociliary nerve, this one, and this is the ophthalmic artery. This ophthalmic artery, it gives supratrochlear and supraorbital branches. It gives supratrochlear and supraorbital branches. These are the branches are the supratrochlear and supraorbital branches of the ophthalmic artery. We have difficult to dissect it, but I will show you the branches. This is a supratrochlear nerve and this is a supraorbital nerve, but these are the vessels which is emerging from the ophthalmic artery. The continuations of this ophthalmic artery medially, you can see along with the anti-ethmoidal nerve. This is a nerve and this is a artery which is passed inside the anti-ethmoidal foramen. Same way there is a post-ethmoidal branches, and here these branches which also gives the medial palpebral branches. Here you can see medial palpebral branches, and then it gives dorsal nasal branches. So these are the medial branches of the ophthalmic artery. So here you can see this is a medial palpebral, anti-ethmoidal, and along with it there is a nasociliary nerve, and it becomes continuous as an anti-ethmoidal nerves. We will complete it. Before it, I will one small revision. This is a So thank you. Hope you enjoy the video of the orbit. We will discuss into the next lecture into the detail.